Medical Aid Films has made this film to explain what happens during a normal delivery. Being prepared for when your baby arrives and knowing what to expect during labour can help you have a safe and healthy birth. It's better for you and your baby if the delivery takes place in a health clinic, as you will have access to skilled professionals and equipment if you need it. Make every effort to deliver in a healthcare facility. However, these are the steps to maximise safety and know what to expect wherever you deliver. Wherever you are giving birth, it's important that you have somebody with the right skills to help you through labour and the birth. This could be your local midwife or skilled birth attendant, and you need to make sure you contact them as soon as you experience the first signs that you're going into labour. If you know your estimated date of delivery, you should plan to travel closer to a health clinic around the time of your birth. Now, let's see what happens during a normal delivery. Before labour starts, you will need to prepare by making sure you have access to clean water and a way to heat it. Wherever you are planning to give birth, it's important that you have a clean, comfortable place to give birth in. When attending a delivery, the midwife will usually bring the things they need to help you have a safe and clean delivery. This should include a new razor blade or scalpel, gloves and clean cloths for you to lie on and to wrap your baby in after birth, ensuring that the baby is kept warm and dry. If you do not have time to travel to a healthcare facility, you may also want to prepare all of these things yourself before you go into labour. Avoiding the risk of infection is very important, so precautions should be taken to protect both you and your baby. This can be controlled very well in a healthcare facility, but is more difficult to control at home. All instruments used to cut the umbilical cord, such as scissors or knives, need to be sterilised before they can be used. This is done by boiling them in water for at least 30 minutes. Ideally, the midwife should use a new sterile razor blade or scalpel to cut the umbilical cord, as they would if you were delivering in a clinic. The midwife or doctor should wash their hands thoroughly with soap in clean running water. And finally, they should put on new or clean gloves. The midwife or doctor will check that your labour is progressing normally. To do this, they will feel your tummy and make sure you're not bleeding heavily. They will make sure you're drinking water and passing urine. They may also check the baby's heartbeat and monitor your pulse and temperature. The midwife will also support you through labour by reassuring you and helping you cope with the pain of contractions. After the baby has been born, the midwife will place it in your arms or on your belly. Keeping the baby skin to skin with you following the birth can help regulate the baby's breathing and heart rate and keep the baby warm. Next, the midwife will dry the baby and check that the baby is breathing normally. The baby should then be covered in a dry, clean cloth, still keeping it skin to skin with you and making sure the baby's head is also covered to keep it warm. Before cutting the cord, the midwife should wash their hands again and put on clean gloves. They will then tie the cord tightly with 2 clean strips of cloth, and taking a new sterile razor blade or scalpel, they will cut the cord in between the 2 strips. It is important to encourage the baby to feed as soon after the birth as possible, as the first milk helps protect the baby against infection. Feeding also helps you deliver the placenta more rapidly. The placenta should deliver on its own within 30 minutes of the birth. If it's not delivered within 30 minutes, or if bleeding is heavy and more than 2 cloths or kangas are soaked with blood, then you must seek skilled care as soon as possible and go to a health clinic if you are at home. Once it delivers, the midwife will check the placenta to make sure it's complete and that all of it has been delivered. If it is an incomplete delivery, this may cause infection and heavy bleeding later. If this happens, you should seek skilled medical care at a health clinic. Finally, the midwife will check how you are doing and advise you on how to feed and care for your newborn baby. So those are the steps to a normal delivery. It's better for you and your baby if the delivery takes place in a health clinic, as you will have access to skilled professionals and equipment if you need it. However, no matter where you deliver, you should follow these steps to help you have a safe and clean delivery and a healthy baby.